Good day, everyone. My name is Jennifer Willis, and today I will be presenting Nurses and Patients' Perceptions of Caring Behaviors, a quantitative systematic review of comparative studies. Caring is viewed as the central focus of nursing. Despite its essential place in clinical practice, researchers and scholars have failed in reaching a common definition. This has led to prompting for unclear interpretations of the concept, often leading to the perplexity and opposing views between patients and nurses. This paper is a systematic review conducted to test the hypothesis that nurses and patients perceive the concept of caring and nursing differently. The purpose of this study is to test the hypothesis that nurses and patients perceive the concept of caring and nursing differently by identifying the best available quantitative literature investigating nurse caring perceptions from the perspective of clients and nurses in a variety of settings. More specifically, the study aims to examine congruence between patients and nurses' perception of caring behavior, and to also identify areas of agreement and disagreement between these perceptions. Several research questions were conducted in this study. First, is there a significant relationship between oncology nurses and cancer patients' perceptions of nurse caring behaviors? Do patients and nurses differ in their ranking of nurse caring behaviors? Are there differences between patients and nurses' perceptions of the importance of caring behaviors? What are cancer patients and nurses' perceptions of the importance of caring behaviors? Do cancer patients and nurses have different cognitive representation of the concept caring and clinical care? And lastly, how do oncology nurses and patients rank caring behaviors in order of importance? Sampling was conducted by researchers using descriptive statistics such as mean, score, standard deviation, frequency, percentages, maximum and minimum scores. The number of participants ranged from 14 patients and 15 nurses. More detailed eligibility criteria for the patient sample were used in specialized areas such as cardio and oncology, and included a histological diagnosis of cancer, patients receiving chemotherapy alertness, freedom of chest pain and physician consent, experience of pain, and pain medication in the last 24 hours. Statistical comparison of patient and nurse group means were performed by using t-test, whereas Pearson, Wilcox, and Spearman rank correlation coefficients were employed for the analysis of association and differences between patient and staff. Also, matched pairing techniques were used, and a three-way ANOVA and the Mann-Whitney U-test were used in one study to compare patient and staff subscale scores within and between scores, and a two-way ANOVA was used in a study of caring and gender. This research study was unique when recruiting their participants in that it compared other research studies. The sites Medline, CINAHL, and Embase were thoroughly searched between March and May of 2009 in order to locate the appropriate articles. Relevant studies were identified by using certain keywords in different combinations. The same search strategy was adopted for each one of the databases. The terms that were searched were care, caring, nurse, nursing, behavior, patient, perception, quantitative, and comparative. The data collection instruments in this review was 18 out of the 23 studies used the Q methodology or a modification, and the rest used other instruments such as caring behavior inventory, caring behavior assessment, and caring dimensions inventory. The CareQ that is most frequently used instrument ranked caring behaviors in 6 different categories, including accessibility, explains and facilitates, comforts, anticipates, trusting relationship, and monitors and follow-throughs. One study used the NCQ and PCQ, which is the Nurse and Patient Caring Questionnaire, that consists of two parts which differ on the instructions. The first part asking nurses to state their preference regarding the importance of caring items, and the second to report on caring work that was actually performed. The results of this study was that cancer patients are the most frequently studied patient group in the area of caring, and the results to whether the cancer trajectory influences the perception of both patient and nurses are contradictory. Findings were patients with cancer and oncology nurses do not differ in the perceptions of caring behavior. Another area of differentiation is the critical care setting, where a low ranking was given to caring subscales like a trusting relationship, expression of positive feelings, and existential feelings, suggested that interpersonal nurse-patient relationship may not be considered very important in the area of practice. Interesting differences and similarities are also reported that patients' expectations regarding caring behaviors are higher when the nurse is a female and lower when the nurse is a male, leading to the assumption that gender stereotypes may affect perception of behavior in others. Further research is needed to generate more knowledge on the relationship between caring behavior, patient outcomes, and health or nursing costs, as well as significant elements of the caring environment. There is a growing body of literature suggesting that congruency of perceptions and goals is important for the patients profiting from caring, and nurse-patient agreement may be the key factor in patient satisfaction and consequently patients' recovery, comfort, health behaviors, and compliance. There were several limitations in this study. The samples were small, the study did not deal with a broader perception of caring, and the study was only a quantitative approach, which it is recommended in future researches to be a quantitative and qualitative approach. The study concluded that nurses do not always accurately assess patients' perceptions on the importance of caring. Some nurses assume the best way to care for the patient on their own. Nurses need to develop the knowledge, skill, and effective nurse-patient communication in order to meet the patient's expectations of which behaviors to express. Nurses need to take into account the patient's perspective so they can link nursing interventions with patient outcomes. The researchers recommend that the hospital leaders should monitor patient-perceived nursing care for further research. This has been my presentation. Thank you so much for listening.